Good morning, Atchison, where the river runs dirty and the gas clouds float. Good times and great weather are in the air today at the first annual Epilepsy Awareness Ironman, taking place right here on Commercial Street. Now, a lot of you might be asking yourselves, Epilepsy? Epilepsy? Mississippi? What's that? Some kind of new soda? Nope, it's actually a recurrent seizure disorder. And to help us understand more about what this means, we have with us a panel of epilepsy experts. Here to explain the pathophysiology of this disorder is the Benedictine College Nursing Department professor, Miss Wendy Woolston. Miss Wendy Woolston, welcome to the show.
Thank you for having me.
You're welcome.
It's great to be here.
Awesome.
So epilepsy is a disorder of neurons in the brain firing spontaneously, and it's characterized by recurrent seizures. A seizure happens when a neuron becomes excited and leads to the synchronization of other neurons. So when one neuron becomes excited, the surrounding neurons become excited. Then you have a large group of impulses going off in a certain part of the brain. So this leads to many neurons firing randomly in other parts of the brain, resulting in a seizure. With epilepsy, people experience epileptic seizures. Now, what makes a seizure epileptic is when it occurs in epileptic tissue. How tissue becomes epileptic is not completely understood, but it is known that normal networks of neurons change in some way to become networks of hyperexcitable neurons.
Well, thanks for all the knowledge, Miss Wendy Woolston.
You're welcome.
And well, there you have it, folks. We now know about the pathophysiology of this disease and what it's all about. Let's return to the race. And this just in, the bikers have begun. Looks like Jocelyn Kleinsmith is in the lead. Wait, oh no. Hello? Yep. All right, thank you. This just in, the All-American Ironman racer Jocelyn Kleinsmith has been lost. She is off course and we don't know where. Oh my gosh, are you okay? I don't believe it. Welcome to the show, Jocelyn Kleinsmith.
Thanks, David. You know, I needed a water break anyhow. This is perfect, really. You know, I am obsessed about epilepsy. Do you know the causes of epilepsy?
No,
Let
I can't
me
say.
tell you. So, you know, it happens that about 50% of those with epilepsy don't actually know the cause, but it can often be due to something genetic. There could be structural brain changes, autism spectrum disorder, brain infections, head injuries, strokes, Alzheimer's. There's lots of different causes. Some risk factors. Do you know the risk factors? Let me tell you. Some of those include babies that are small for their age, brain bleeding or tumors, stroke, cerebral palsy, a family history, use of illegal drugs like cocaine, that type of stuff. You know, but usually they just don't even know.
Wow, all right.
Yeah.
Sounds like you got a race to get
Yeah, I gotta get back, but
Okay.
this thing I
Sounds good.
Yeah.
Yeah, you keep drinking water.
Bye, thanks, David.
Yep, thanks, Jocelyn. We wish you all the best. Now joining me is BSN RN, PhD, MedSurg certified, mother of 15, also running for General Surgeon of the United States, and only 28 years old, is Dr. Abigail Merck. Dr. Abigail Merck, welcome to the show.
Thank you so much, David.
You're
for
welcome.
having me.
Yes,
I'm
of
very
course.
excited.
I'm glad you're here.
All right, so what I'd like to talk about is the classic manifestations that you see with seizures, because as we know, thanks to Mrs. Woolston, that epilepsy is a disorder of reoccurring seizures. Now, when you think of a seizure, you may think of some of the common symptoms like muscle spasms or loss of consciousness. However, there are also many different types of seizures, and everyone exhibits them in a different way. The two main types that I'd like to talk about are focal and generalized seizures. Focal, or also a partial seizure, only affects one area of the brain, and this makes up about 60% of those with epilepsy. There are two types of focal seizures, a simple and a complex. During a simple focal seizure, the person remains conscious and experiences unusual feelings or sensations. During a complex focal seizure, the person has a change or loss of consciousness and enters a dreamlike state. And you will often see repetitious behaviors like twitching or walking in circles. Generalized seizures have multiple origins in the brain and cause a loss of awareness or a loss of consciousness. The manifestations of these seizures can range from the person staring off into the distance, almost zoning out, to the person's having muscle stiffness, muscle twitches, large jerking motions of the upper and lower extremities. So with these seizures, it is also common to have something called an aura, which is a precursor to the seizure. Auras are these unusual sensations, like smelling something unusual or experiencing visual changes that occur before the seizure is about to begin and act as almost a warning sign to the upcoming seizure.
Wow. Thanks so much, Dr. Merck.
Yeah.
I'm really glad that we finally get to know more about what these seizures actually look like and what's going on.
Thank you, David.
Thank you. Stay tuned for more epilepsy information right after this short commercial break.
Are you experiencing muscle spasms and seizures that cannot be controlled? We have the medication for you, Valium. Valium relieves muscle spasms and works by calming the brain and nerve. Take as directed by your doctor. Sudden discontinuation of medication can cause withdrawal symptoms such as shaking, abdominal cramps, sweating, vomiting, restlessness, anxiety, and seizures. Side effects of this medication include dizziness, drowsiness, tiredness, blurred vision, or unsteadiness. If these symptoms last or get worse, notify your healthcare provider immediately. Choose Valium.
Welcome back to Atchison Daily News. Ella Sipe, winner of the Ironman, has just agreed to come in and discuss her race experience with us. Congratulations, Ella.
Thank you so much for having me. I'm so excited to be here. I just ran so fast and biked so hard and swam my little heart out, all for my little boy who suffers from epilepsy himself. I just can't.
Wait a second. Did you just say you have a son with epilepsy?
Yeah.
Can I have his phone number?
Sure. But why do you?
William? Yeah. Hey, are you there? Hey, yeah, could you please tell us about how epilepsy has changed your lifestyle? All right, I'm gonna put you on speaker. Is that okay? Awesome.
How epilepsy's changed my lifestyle? I think in a lot of ways I consider myself really fortunate. When it comes to, my condition with epilepsy, I think I have extremely mild epilepsy. You read online, when you first hear epilepsy, I think people think, at any given moment he's around a strobe light, he could have a seizure. That's not really how it works for me. I know there are people that have sometimes up to 20 seizures a day, and I can even imagine something like that. But I'm very fortunate. I do take medication for my epilepsy. I take Keppra, which is a very common epilepsy drug, which helps to prevent seizures. But really, when it comes to the epilepsy itself, to seizures, for as long as I've had it, it's only been 1 to 2 seizures a year. So, never anything very serious. So I think I'm really fortunate in saying that it hasn't changed my lifestyle very much. The most recent seizure I had was January of 2017 of this year. And after that, that was my second seizure, that I had while I had my driver's license. And because of that, I had my license revoked for 6 months. That's probably the biggest toll that my epilepsy's really taken on me. It gets frustrating, It really gets in the way. But I mean, like I said, it's really not very serious for me. I can't complain, when you read some of the stories and what is, probably discussed when you hear the word epilepsy and stuff like that. I really have it pretty nice. I take pills in the morning, pills before I go to bed. If I forget to take my medication for long enough, that could cause a problem, but that's just, my memory. I just have to stay committed to taking pills. It's my laziness that could cause me to have a seizure more than anything else. So, how's epilepsy changed my lifestyle? I think, very fortunately, not very much.
Wow, William, thank you so much for telling us about your lifestyle and how it's changed since you've had epilepsy. Well, thanks, Ella. You have a great day.
Thank you.
And that's all for today, folks. Thanks for tuning in, and I hope you have a great weekend.